Hey guys, stay tuned. I'm going to be covering exactly all the key changes that occurred in 2024 that was caused by the Inflation Reduction Act of 2022 and how that can impact you. Stick around. Before that, we're going to cover the key changes in 2024. One was the elimination of 5% coinsurance required in the catastrophic phase. So for some of you guys that have been on Medicare for a long period of time, if you don't understand this, there's been 4 stages in prescription drug plans: the deductible stage, the initial coverage stage, the coverage gap or the donut hole, and then the catastrophic stage. And to simplify this, sometimes your plan had a deductible, sometimes it did not have a deductible. You had to meet the deductible, and then the plan copay or coinsurance structure would start. Most plans have 5 formulary tiers. Tier 1, Tier 2 are usually generic. Tier 3 is usually a name brand. Tier 4 and Tier 5 are non-preferred specialty drugs. Most of you guys are on Tier 1, Tier 2, or Tier 3 drugs. And you would have a copay amount, and the plan would pay, and then the total cost of that, what they call troop, would calculate up to a certain dollar amount and push you into the donut hole. During the donut hole, or the coverage gap, you would pay a percentage amount, and what it's been based on has been 25%. Prior to that, you would pay a higher cost. Over the years, I've seen people pay hundreds and hundreds of dollars during the donut hole. So your calculated amount, what your true out-of-pocket cost from January 1st of that year, once it reached to about $8,000, it pushed you into this thing they call the catastrophic stage, and you would pay 5% of the cost of the medication until the calendar year end, unless you're on a Tier 1 or Tier 2 drugs that covered through the gap and had predictable cost of zero copay. Otherwise, you paid 5%. Well, great news. They eliminated that 4th step and that 5% penalty, basically a penalty or fee, however you want to look at it, but that cost for the medication in 2024 has gone away. So if you push into the catastrophic coverage, sometimes some of you guys would go into that in maybe July, August, because you had very, very extremely high medications that you've been on, or maybe in the fall of the year, you saw the price of your medications kind of jump up, or maybe jump down some because 5% was going to be less than the copay and coinsurance during the donut hole. It would drop down in the catastrophic stage down to the small amount. Well, guess what? That's gone away in 2024. That's big news. So if you're like, hey, I paid more last year, and the cost of living and milk, bread, and eggs went up, but this cost of my medications this year after about July or August, when I came through the donut hole and went to the catastrophic stage, everything went to zero. Well, that's why. This rule caused that to go into effect. The expansion of Low Income Subsidy Program, the income eligibility for Low Income Subsidy Programs was expanded. So that just means if you can make a little bit more and still qualify for Low Income Subsidy. We actually are going to have a deep dive into this on another video, so watch that. Look for the Low Income Subsidy expansion and be able to watch that video. That'll be great information for you guys that are on fixed lower incomes, that's maybe been on low income subsidy and reduce the cost of your medication. Or if you have a certain income amount, you can qualify. It's a federal program and it reduces the cost of your medication. But they made changes, expanded the income amount allocations. Individual incomes up to 150% of the federal poverty line became eligible for full LIS benefits. And so that just means the cost that you paid for your medication, if you did qualify, was reduced down to a very small marginal amount of copay or coinsurance for the entire year. So that was huge for 2024. Also, the limits on premiums increased. Starting in 2024, the calculation for the base beneficiary premium for Part D was adjusted to limited premium increases to no more than 6% from the previous year. So basically, they capped the inflation cost that a Medicare prescription drug plan or a contracted carrier, MAPD, or prescription drug plan that was submitting a plan to Medicare, they cost their price increases for premiums at 6%. So it's going to be a 6% increase or less. That happened in 2024. Now let's move into what's going to be happening in 2025 and the major changes that are coming in 2025. And this is going to be kind of going on in some video stuff that we will bring to you. I'm going to go over kind of an overview of what's happening in 2025 and why you should be worried and concerned about it and how it could impact you. One, out-of-pocket cost spending caps. Starting in 2025, there will be a $2,000 annual cap on out-of-pocket drug spending for Part D enrollees. So what does that mean? That means you've paid $3,000, $4,000, $5,000 in previous years, or up to a certain dollar amount depending on what stage you're in. The max amount that's going to come out of your back pocket this upcoming year, January 1st, 2025, and moving forward, this portion of the law is going to be written into history and be a part of Medicare prescription drug plans. What's going to happen is the cap amount is going to be $2,000. So $2,000 or less is what you're going to pay for all the costs for your medication. Now, how does that impact you? Well, that additional money has got to be incurred by the Medicare prescription drug plans or Medicare Part C plans. And then what we are seeing that's going to probably happen is it's going to incur higher costs for premiums, deductibles. There's going to eliminate costs on formularies. We'll talk about this a little bit more in detail, but your formulary is going to change. So once your formulary may have had hundreds of medications on it, they're going to reduce those formularies down. There's going to be medications that don't have to be covered by the formulary regulated by Medicare, that Medicare formulary prescription drug plans have been covering, that they don't have to cover, and they're going to take those off of the formulary. And so they're going to reduce it down to, like I said before in a previous video, 2 medications have to be covered under each category of medication. So an insulin, they have to have at least 2. If they've got 20 now, they're going to reduce that down to the cost of the medications that are I say insulin because they're covered by the $35 copay. But any category that may have 20 drugs, they may reduce that down to 10. Well, how does that impact you? Well, you may be on a medication that's hard to find on any formulary and have to pay out-of-pocket costs for that. There's going to be a lot of moving parts when it comes to that. So your out-of-pocket spending cap is going to be at $2,000, but they say they're going to reduce the financial burden based on the formulary or based on the prescription drug plan you're on, but based on the formularies and changes that can occur to premium and other things, it actually can push off some other impacts in the plans. One, Medicare Advantage plans. Copay costs and all types of moving parts with the Advantage plan carrier may raise, or they may degrade the benefits, the dental, hearing, vision. We don't know yet. It's not been rolled out. It's not until October 1st we can start talking about this. One of the things we do know for sure, when they suppress costs in one area, it makes costs go up in another area. And if you haven't planned correctly to have your plan reviewed, you need to. It's a very urgent matter to be concerned about because your costs can go up. The coverage gap or donut hole will be eliminated, simplifying the cost structure for beneficiaries. So basically you're gonna have a stage 1, stage 2, and then the coverage of the donut hole, coverage gap, and catastrophic, that's going to be done away with already. Last year or this year, they've eliminated the catastrophic cost of 5%, that's gone. And then the stage 3 of your prescription drug plan is going to be eradicated, and you're just going to be paying the deductible, your copay costs or co-insurance costs up to $2,000, and then the plan is going to cover everything 100% and beyond. You will not have any costs out of pocket beyond that. Monthly payment options, enrollees will have the option to spread their out-of-pocket cost over the year through the Medicare prescription payment plan. Rather than paying large sums at once, this will provide more manageable monthly payments. So this is another thing that's going to be happening that's going to basically take the total cost of medication and spread it over 12 months. Drug price negotiations. We'll talk about more detail about the monthly payment option and drug price negotiation. The Center for Medicare and Medicaid Services will begin to negotiate prices for certain high-cost drugs, which is expected to lower costs for these medications starting in 2026. Well, let me tell you what happens in situations like this. Politics get involved, and when you start messing with pharmaceutical or big pharma, where big supporters come for super PACs on both sides of the Republican Party and Democratic Party, it doesn't matter which side of the fence you're on, there's a lot of money involved in big pharma and educating and being educated on when they say drug price negotiations. Some of this is kind of a slippery slope on exactly what's going to happen starting at the first of the year. Some of that we do not know. It's rolling out to us. As we start getting that information, we're going to start communicating it on our YouTube and also providing this information to you out as soon as we can. So I would encourage you guys to like, subscribe, be a part of our channel, follow along as we educate you through this process and all these changes coming in August, September, and then October, you'll be able to understand all the implemented rules and then how the plans have changed. If you have somebody you're working with, great. If you do not have a licensed expert, call us, schedule a time. We'll do a review now, but more than likely set it up for October or November to review your plan options and tell you what changes. If there's nothing that's changed in your plan that requires you to change, then great, you don't have to do anything. If there's major changes for you and there's ways to save you money changing your plan, then you need to look at that this upcoming fall. So that's a big kind of ask and tell that we've been sharing with most people. Manufacturer discounts. Drug manufacturers will be required to provide a 10% discount on brand name drugs during the initial coverage phase, replacing the current 70% discount in the coverage gap. So there'll be, instead of 70%, it'll be 10%, and that'll be in the first phase. And as we get closer to the annual enrollment period for 2025, which starts in October, we're going to be talking a little bit more in detail about this and how that looks as far as plans and cost and things like that. So be watching for those. These changes are designed to make medications more affordable and predictable for Medicare beneficiaries, addressing the high cost of prescriptions and reducing the financial strain. The problem is, again, guys, when you say reduction and you reduce the cost here, that cost has to be absorbed that's been reduced by someone, and that goes back into the carrier's Medicare Advantage prescription drug plans, the MAPD plans that you may be on, and also the prescription drug plans, the standalone drug plans that a lot of you have with Medicare supplements. It's going to affect cost, and it's going to push into the different plan options and reduce, degrade the benefits potentially. That is what we're being told. And as I said, as we get into the fall of the year, just be aware of reading, watching, finding content like this is going to keep you informed, just allowing you to be able to make informed decisions as we push towards the ending of this year and go into the AEP season. As I finish up here, guys, one of the things that you need to be reminded of is, again, your ANOC, the annual notice of change. It's going to be coming in September, at the end of the September month. It comes from your carrier. So if you have a Medicare Advantage plan, they're required to send an ANOC. If you have a standalone prescription drug plan, they're required to send you an ANOC. That's going to tell you what's been going on this year, and then all the implemented changes for 2025. And if you see situations there that you're unsure of, get with someone, schedule a time with us or your agent or whoever you're working with. But look for those changes, and you're going to see some of these things unfold into like Medicare Advantage plans. The degradation of, hey, I used to have copay cost of this, now they've raised, or this on the plan has gone down. Prescription drug plans, what we're being told is potentially the premiums are going to be exorbitantly higher, and then the deductibles are going to be much higher. Most prescription drug plans are going to have the potential of having a deductible. And then we're being told other things about Medicare Advantage plans. So as that information becomes available, information that I can release and share, I'll be able to share. Some of that is not able to be shared until October 1st of this year, when we can by Medicare standard begin to release information about the information coming of 2025 plans. But this Reduction Act is going to make changes. You need to be aware of it, stay on top of it. We'd love you to follow along with our stories as we share those, and the information as I begin to share and continue to share through our channel. If you have not subscribed, do, and until next time, I will see you on the other side.